acid make sure.
Hello and welcome into this week's edition of AFMC TV. We're glad you're here. Joining us today is Dr. Beth Milligan, one of the doctors here at AFMC, and we are talking about hypertension, otherwise known as high blood pressure. Hi, Dr. Beth. How are you today?
I'm fine. Thank you.
So high blood pressure, May is Hypertension Awareness Month. So I guess my first question would be, how do we know if we have high blood pressure? Is it something that we could tell internally, or do we need a doctor's diagnosis?
Well, Michelle, high blood pressure is silent. Most Americans, when they started out, had no idea they had high blood pressure. You usually don't have a lot of symptoms initially on, and it's actually discovered by routine medical visits when you go to see your doctor.
So another reason why those checkups are so very important.
Absolutely.
So what are some symptoms of high blood pressure?
Well, after you find out you have high blood pressure, then you're going to realize that sometimes those headaches you were having, unusual fatigue, were probably due to the high blood pressure being untreated for so long. And at that point, you'll notice other things. I personally have high blood pressure, and when my pressure, I've learned to feel when my pressure would get up. I'd feel my head would be unusual headaches that I wouldn't normally have, or blurry vision. And those things are really reasons that you do need to see somebody. So you need to learn to read your body's symptoms.
What are some of the effects of high blood pressure, particularly if it is left untreated?
But that's a good question. When your blood pressure is left untreated, one of the reasons we've learned is that blood is just pounding through the kidneys and through the heart. And we don't want that to happen. So that's when we use, medications to lower it. If you don't do it, or you're non-compliant, you've been told to take your medicines and you choose not to because you feel better off of them, that's when you start having problems with your kidneys, with your eyes, and with your heart, because that literally that pressure of that pounding blood on those organs is just too much for them.
So we generally associate, or at least I associate, high blood pressure with older adults. But is this something that children or teens, youth could even develop?
Well, interesting question. I actually had high blood pressure as a younger person. And initially I didn't know, but a routine doctor's visit found out that I had it. But yes, we're discovering that our children, as they become heavier from more sedentary issues, can develop high blood pressure much younger. And it's an issue that the medical pediatricians are seeing this a lot more in their younger people.
So one way to maybe alleviate it, at least for the kiddos, is to kind of watch that diet, but make sure that we're getting exercise.
Well, and it's the same answers that you have for your youth or your young people, that answers that would give to me or our older people, is we need to be more active. And you've done these topics, the need to get up and walk around and not sit all day long, the need to be more conscientious of what you're eating. You're adding salt to things. I've been guilty of that. I'll add salt before I taste the food, and that's such a bad habit. And the need to be more healthier weights. Obviously, we found that people who are able to get some of the weight off, their blood pressures actually start to improve. So there's a lot of benefits from modifying and learning to be healthier.
I'm so glad you mentioned that, because I was curious, if a person is diagnosed with high blood pressure, can it be reversed maybe through diet and exercise?
Michelle, high blood pressure is a chronic medical condition. So we found that you really can't cure it, but you can manage it. So one of two things: you can either have to take blood pressure medications, and that's okay if you have to, I do, to get it under control. But also the lifestyle changes we found, as people lose weight and become more healthier, they can actually come off the blood pressure medications, which some people may view as curing it. However, you're technically not curing it, but you're definitely improving your lifestyle and your longevity.
Okay. Dr. Beth, anything else you'd like to add?
I'd like to say that you shouldn't be afraid of getting the diagnosis, because I personally have it. And I think being able to get control of your blood pressure would decrease the more dangerous things like having a stroke, which I had a stroke. So I actually want to keep my blood pressure under strict control so that I actually remain healthy and feeling better. So don't be afraid. Don't be embarrassed to get that diagnosis. Own it and get on top of it and control it before it's too late.
All right, great advice. Dr. Milligan, thank you so much for joining us. Rebecca Denniston joins us now from the Dermatology Group of Arkansas, and we are talking about Botox,
Yes.
or alternatives to
Yes.
Botox. So let's first start by just answering the question, what is Botox?
Yes. So Botox is basically a brand name for botulinum toxin.
Lovely.
Yes. So when you see Botox, it's kind of a brand name. There's a couple other names as well. So Xeomin, Juvo, and Dysport. They're all kind of in this botulinum toxin family.
Okay.
And what it is it's a neuromodulator, and it works to paralyze a subset of muscles. So wherever you inject it into the musculature, it's going to paralyze those muscles. Okay. And the reason we do that is to prevent fine lines and wrinkles, or treat fine lines and wrinkles. The Botox in particular, it typically kicks in about a week to 2 weeks once you have the injections done. And then it lasts for about 3 to 4 months on average. And then it is something you have to keep up and you have to keep doing. So it's not a permanent fix for fine lines and wrinkles, but it definitely works very well.
So once you start, you need to be ready to commit.
Yeah. I mean, there are patients who they come in, every once in a while and have it done. But at that 3 to 4 month mark, when it starts wearing off, your wrinkles are going to come back.
They start coming back.
Yeah.
Okay. So what if we don't want to inject this botulinum toxin into our face?
Yes.
Are there other products or procedures that we could achieve something similar?
Yes. So kind of yes and no. There's nothing that's going to identically give you the same results as Botox, as far as the long-term results and all of that. But there are some products that can help. One of them is hyaluronic acid. So hyaluronic acid works by drawing water into the skin, and therefore it plumps the skin and improves fine lines and wrinkles. Okay. So that's kind of going to be the main thing that would mimic similar to what Botox would be doing, but you're still going to be making those movements. You're still going to have some fine lines and wrinkles, but they're going to look a little bit more plump and full and better, but it's a short-term treatment. So it's something you would have to do every day.
Is that something we can purchase over the counter? Or
yes, you can. Okay. Yeah. So there's quite a few product lines now that offer hyaluronic acid that's built into, say your sunscreen or your moisturizer. But hyaluronic acid serum by itself is going to give you probably the best bang for your buck. And so there's quite a few brands. SkinCeuticals is a really popular one, but there's lots of ones on the market.
Any other procedures maybe that might be an alternative?
Yeah, definitely. So procedure-wise, you want to think about increasing your collagen production. Okay, so with Botox, you're paralyzing the muscle, and then therefore you don't make that movement. With procedures such as laser and microneedling, you're stimulating collagen growth to hopefully fill in those fine lines and wrinkles. But it's typically a series of treatments with laser and microneedling. They're working to create microneedlized holes in the skin, so you stimulate your body's own wound healing processes, and therefore you stimulate collagen. And so those definitely work, but again, you're still making that movement. But a lot of people really go more towards, laser and microneedling because they don't want a foreign substance in their bodies. And so it's an easy way to achieve results without doing something like that.
Can you take collagen and still achieve some of those results? I hear of people who might take it, put it in their coffee, or take supplements, or are we talking about two different things here?
Yeah, so there are no studies to date that really show the efficacy of collagen taken orally. Okay. Maybe down the road there will be something, but for now, there's really nothing that says, yes, if you take this product, you're going to get results in your skin or your nails and such like that.
Okay. And one more question about the Botox, and this might be an old wives' tale, but does it help with people who suffer from migraines?
Yes. So there is definitely an FDA-approved treatment for migraines using Botox. Okay. And so those typically are going to be done by a neurologist. So most dermatology offices are not going to do that procedure. Okay. But as far as FDA indications for Botox, migraines are one of them. And then there's certain areas on the face that are FDA-approved for Botox. So your forehead lines, your glabella, which are your 11 lines in the center, and then around your eyes. Okay. And those are all on label FDA approved.
Okay. Or you could just not smile. And
That's
then
right.
You don't have to worry about having lines.
Yeah, because I mean, if you think about it, majority of our aging comes from the musculature in our face. And so as you move, you're going to get fine lines and wrinkles over time. So actually more and more people are doing Botox for prevention. So younger people are coming in wanting to prevent the fine lines and wrinkles. So maybe they don't have much yet, but they don't want to get the fine lines and wrinkles.
Play catch up. Yeah. Okay. Becca, is there anything else you'd like to add?
Yeah, I mean, I think one of the big things with Botox to think about is if you decide to do it, it's not permanent. So if you do it and you don't like it, you just don't do it again. Yeah. But it's becoming more and more of a popular procedure, but there's definitely alternatives like we talked about.
Okay. All right. Great information. Yes. Thank you for joining us today. Yes. And thank you so much for joining us. We'll see you back here next week for more AFMC TV.